America's first hospitals were safety net hospitals. Bellevue in New York, Charity in New Orleans, these were the first hospitals in America. And back in those days, wealthier people didn't go to hospitals. The doctors came to their home to take care of them. Poorer folks first went to the almshouses and then went to these dispensaries that later became the hospitals. The modern American hospital is based on those places. It's based on the safety net. Our members really created that model 200 years ago, or more than 200 years ago.
The National Association really came into existence because a few of us felt that the American Hospital Association, a wonderful organization all by itself, didn't quite represent the public hospitals as a group, and there were some important differences. We had different needs. For example, reimbursement for the disproportionate share of people without insurance that the public hospitals took care of.
I think it was at an NAPH meeting that I heard that, the numbers may not be exactly right now because, memory fades, but that Alabama was getting $100 million in DISH, and the whole state of Colorado was getting like $3 million. And I was like, wow, what's wrong with that picture? And NAPH really helped us get the facts, get the data.
Really became involved with NAPH. It was in the very beginning of the AIDS epidemic, and we were the providers that really stepped up to the plate. And there were providers in the private sector that wouldn't even be willing to see these patients, but the public hospital systems, with their commitment to vulnerable populations, regardless of their ability to pay, stepped up.
It's essential that you understand, as you debate health reform, that the importance of these hospitals and health systems extends to the services they provide to their entire communities and not just to the poor. The tidal wave of the walking wounded refers to the extraordinary services provided to thousands of California earthquake victims by the hospitals of the Los Angeles County Health System. These services are available only because they are currently supported by a fragile web of funding sources, including local taxpayer subsidies, Medicare and Medicaid disproportionate share and teaching adjustments, and a very limited amount of private sector cost shifting. And these stories are not isolated or unique.
Understanding what's happening in Washington, they're based in Washington, they're kind of following the rapidly bouncing balls, particularly through this election cycle, and the transition of healthcare reform nationally has been really important, and NAPH brings a unique perspective.
Went into this profession to take care of others. What better way than to be at a safety net hospital?